Getting ready to dissect a cat. First thing you'll note on your tables, you will have trays with cats in them. They will be bagged. They are double bagged. Look underneath the bag. Hopefully we'll have some paper there as absorbent. And so the first thing you're going to want to do is get your cats out of the double bags. The first bag won't have any fluid in it, but the second bag is going to be loaded with fluid, so please be careful. Top of the bag off. And now I'm just going to zip down with my scissors and go all the way down the middle. That makes this open nicely here. And now I can just pull the cat out and take the first bag out. Throw that bag in the garbage because you will not be using that again. Do the same thing with the second bag. Cut off the top. If your scissors don't cut this well, change scissors because some of these scissors are pretty dull. And again, zip along the top. And you can see how the scissor goes very nicely down there. Gets it completely opened for you. And now, trying to keep as much of the fluid in the bag as you can. Lift the cat out and then have this near a sink. You're going to try to get as much of this fluid without dripping it all over the floor. Put the cat on the tray with the papers, and you'll want to put this in the sink. Now that you've got your cat on the tray, you do want to keep it moist and wet. That's what will keep this thing lasting a long time for you. The first thing you want to do is identify some of the surface anatomy before you even do any cutting. So obviously we see the head up in this direction, the thoracic cavity way up over here in this direction. The rib cage ends right around this region here, and then the abdominal cavity down in this region. The abdominal cavity is what we're going to get exposed today. Legs down here, arms up in this region. So how do you start? Where do you even begin? You need to identify for yourself how deep is the skin. Where'd my scalpel go? So the way you identify how deep the skin is, if you go over where the sternum is and push down on your knife, you could feel where the bone stops you. And then if you look at, you pull this up here, you can see how thick that is. And this cat is pretty thick, and that's because we see a lot of muscle in this particular cat. So go that deep, make a longitudinal incision all the way down the cat, and you can see I've already done that, and go all the way down to the pubic bone inferiorly and all the way up into the neck superiorly. Now that you've done that, you want to make crosses laterally across the body. And the first one I like to make is above where the rib cage is. So I'm identifying that the rib cage, inferior border of the rib cage is over here. I like to stay superior to that. Most YouTube videos will show you them making the lateral incision much lower than this. The reason why I like to do that is I want you to be able to see the diaphragm. And you won't see the diaphragm if you keep it down too low. So I make my lateral incision here, going the same depth all the way over here. Not too concerned about how deep I go here. Why? Because I've got the rib cage to keep me from going too deep. Go all the way down at the inferior aspect. And again, YouTube videos that show you a dissection of cat like to show you down here by the groin area where the legs are. I like to keep this loop more superior, especially when we're doing reproductive system of the cat, because you can identify the inguinal canal. So I made my lateral incisions down here right there. And how deep did I go? I went to the thickness of the skin. It's a couple of millimeters thick. If you want to see how thick that is, I've already exposed this area right there. Now that I've got my skin incisions, you can almost put your knife down, find a good sharp scissor, and then using your forceps, where'd my forceps go? I had it over here. Pull up another one. And grab the corners here and stick your scissor in there. And as you stick your scissors, spread your scissors. And then stick your scissor in there and spread your scissors. When it gets real tough, just use this part of your scissors and make some cuts. And so there I am making cuts here, making cuts here. And you can see how I'm exposing what's underneath. I do the same thing over here. Stick my scissor in there and spread. Stick my scissor in there and spread. This is called blunt dissection. Anywhere where it's connected, I use my scissor to cut. And you can see how I got this whole flap completely exposed. Do the same thing on this side. I cheated a little bit. That was already done. Sorry about that. My video was supposed to be on and it hit snapshot instead. Do the same thing on this side, and you can see how I get this whole flap of tissue exposed down here. What we're seeing right here is the rib cage. So I even went a lot more superior than I really even intended to. If my incision down here is not far enough, I just use my scissors and keep cutting more. You want more exposure? then cut. This is not surgery, so we're not concerned about being able to put this cat back together, about closing things up. We're concerned about exposure. So keep snipping. See how this is freeing up as I do that? Snip, snip. Same thing. Something's holding it right there. Just stick my scissor in there and cut, cut, cut. What's eventually going to be exposed is this, whatever is attached to the inferior aspect of the ribs here. And you know from your AP1 class, what is attached to the inferior aspect of the ribs right there is the diaphragm. And so follow your scissors underneath there and detach the diaphragm from the inferior aspect of the rib cage. And so that should help us expose the diaphragm. This big brown thing that we're seeing in this cat, now this can be different colors on different cats. In this particular cat, it's brown. But in this particular cat, it's brown. That's the liver. A huge liver in this cat, by the way. Not always this big. Sometimes a little bit small. Anything that's in your way right here, just remove it. Have paper towels handy and available, and just put all of that stuff in the paper towels for now, and you'll throw that out later in the red bins. You want to get rid of some of these lower ribs? Yeah, just use your scissor and cut. You got a bone there that you want to cut? Then you take something like this, a bone cutter. This is actually a nail cutter, but it does the same job. I'm going to cut the xiphoid off, okay? Boom, you heard it snip. Cut that off. Let's get that out of the way. You know why? Because what's attached right there? The diaphragm. And again, I want to expose the diaphragm. I don't want you all to see that. By the way, that's usually on your midterm exam, being able to identify the diaphragm. So I'm going to cut some of these ribs away, these lower ribs. And what we're starting to see is that structure right there, and that is the diaphragm. Keep cutting along the inferior border of the ribs. Follow it back, and there it is. That muscle right there, that's the diaphragm. Let's expose it a little bit more. Let's cut some of the sternum off here. Let's split that sternum right there. Let's cut the ribs off that are attached to it right there, which actually it's costochondral cartilage, right? That's how that attaches. Let's lift this up. Let's get our cutters in there. Snip and snip. All you got to do is snip. And this is all about exposure, so you can see what we're looking at. Snip and snip. After a while, even the scissors will be able to cut it. There we go. And that we're going to get rid of in the biohazard waste. Look at that, getting beautiful exposure of the diaphragm on this side. Let's continue down this side. They're taking off the lower part of the rib cage. We have to remove the attachments of the diaphragm to the lower ribs. Again, all about exposure. This is dissection. This is not surgery. Okay. Now you can see a beautiful specimen of diaphragm. That's all diaphragm muscle right there. What's above the diaphragm? Your thoracic cavity. That's the lower lobes of the lung. There's the lower lobes of the lung here on the left side and the lower lobes of the lung here. What's right below the diaphragm? This big guy here. These are the lobes of the rib, of the liver in this cat. So huge, huge liver. They have 5 lobes like you learned about in your presentation. Let's remove some of this attachment right here. Okay, right there, which is a little bit better. Again, I want to extend my incision down here. No big deal, just take my scissor and snip and snip. You're working alone, you need some help. That's when you use instruments or tools like these. You know, stick the points in there and hold that down like that. Or you can even use what's called a hemostat. These are called mosquitoes when they're tiny like this, and clip on that structure, and that'll help hold it out of the way. That's when you're working on your own. You have to do tricks like that. So now that we've identified the liver, where's the lobes of the liver? I don't particularly test on that, but these two here, you can see these are the 2 right lobes. This one's the medial right lobe of the liver, lateral right lobe of the liver, and in between them, you're going to have this little tiny structure here. I like to call that thing the deflated balloon. That's the gall bladder. So in the cat, that structure right there is the gall bladder. Let's see if we can clean them up a little bit. I'm going to get a little bit of fluid to put on that. hold on a second, I'll pause. So when you want to see things better, wash it off, okay? So I've got this thing filled with humectant, okay? And you just squirt it, wash it off, use your paper towels, and now you can see that gallbladder a little bit better. Same thing with the greater omentum here. There, getting it washed off, okay? We're done with that. So those were the two right lobes of the liver, and in between the two right lobes of the liver is where you find your gallbladder. Here's the two left lobes of the liver. We pick them up and separate them a little bit. There they are, 1, 2. That's the medial lobe of the left liver, lateral lobe of the left liver. And then we have a caudate lobe, and that's the lower lobe of the liver, and that's going to be down underneath all of these structures here. What's underneath the liver when you lift this guy up is the stomach. So there's your stomach on this particular cat. So what's all of this fat stuff here? Well, let's continue the exposure down here. Let me move my bone cutter there. Continue the exposure down here and move this flap up and out of the way. I want to hold that over, so I'm going to use my hemostat and grab that thing right like that. Pull that over there. Same thing on the other side. Get another hemostat. Put this over and pull it this way. Okay, did I get enough exposure, or do I want more? I want more, so I'm going to snip, 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 and cut, cut, cut. Pull this stuff away. Do I want to go down here laterally more? Sure, let's go. Let's expose that more. Now, this is all greater omentum, all of this stuff right here. It's the apron-like structure that covers all of the small intestines, most of the large intestines, okay? And look at it all. There's a whole bunch of this stuff. And you need to separate that all. You need to get this all separated. And you can see how it wraps around everything. It doesn't just cover it. It actually envelops it and goes all in between it. This one is particularly so. But we need to get all of that greater omentum off. I'm trying to be delicate and not completely destroy it, because I want you to learn about greater omentum and see how this goes. So here it is. We're pulling it off. Keep pulling it off, exposing everything underneath it. Look at that. There it is. There's the apron-like structure called the greater omentum, loaded with connective tissue, blood vessels, arteries, veins, lymphatics, and adipose fat. When you pull this thing up, the next thing you will be able to discern is that it makes a connection and is hanging from the greater curvature of the stomach. So that's the next thing we want to expose. This particular stomach in this cat is very full, by the way. But there it is. There's the stomach. There's the greater curvature of the stomach. And here's the greater omentum hanging off that greater curvature of the stomach in this cat. You keep pulling on this and go left and laterally. Remember, it's the cat's left, not yours. And what you pull out next, in the left lateral gutter, that structure right there, and that's the spleen. So the spleen is right next to the stomach. Here's what they look like in this particular cat. This ligament that's going from the stomach over here to the spleen, not this part that's part of the greater omentum, but the part that's going to the spleen is the gastrosplenic ligament. There's the spleen, there's the stomach, there's the greater omentum, there's the liver, 4 of the 5 lobes, and there's the gallbladder. Coming out of the stomach, well, first let's go the lesser curvature of the stomach up here. So we need to get a little bit better exposure. Let's see if I can hold this guy up like this. Is the lesser curvature of the stomach, and that's the lesser omentum up and in there. So I'm not sure if you're seeing that good, but there's lesser omentum. I know you can't see that well, but don't fret about that too much. Coming out of the stomach here is going to be the next structure. It's the first part of the small intestines. Let's kind of reflect all of this greater omentum to this side. And what is all of this curving tubes here? That's the small intestines. And the first one that comes out of the stomach, this one right here, is duodenum. In the cat, it's the first couple of inches, 2 or 3 inches here, and that's all duodenum. That will lead to is the next 2 parts of the small intestines, and that's all of this stuff right here, okay? Now, on gross anatomy, when you're looking at this, you cannot discern where does those 2 parts end. What are they, first of all? After the duodenum, you have jejunum, J-E-J-U-N-U-M, jejunum, and then that will lead to the ilium, I-L-E-U-M, the ilium. So where does the jejunum end and ilium begin? We can't tell. You cannot tell on gross anatomy. Physiologically or histologically, if you cut this and put it underneath the microscope, you will see changes because there's different functions between those two regions of the small intestines. But for the purposes of this class, and on your midterm practical exam, I would stick a pin in this structure and say, what's the middle segment? And what's the middle segment? You have duodenum, jejunum, ileum. The middle segment is jejunum. What's the first segment? That would be jejunum. And what's the final segment? That would be the ileum. Now, duodenum and ileum we can further identify by if we first identify where the small intestines is coming out of the stomach. That is always duodenum. The ileum, the end of the small intestines, always goes into the very first part of the large intestines. And if we keep following the small intestines, eventually we get to where the small intestines goes into the large intestines. And that's what I'm going to uncover next. So what we got down here, right there, this is the small intestines right there. Let me get my big fat hands out of your way. And there is the small intestines going into the large intestines. So that is ileum. It can only be ileum. Jejunum does not go into the large intestines. Now, how do we know this is large intestines? Well, here's the girth or the width of the small intestines. Here's the girth or width of the large intestine. It's bigger. That's it. These are smooth. So this is different than the human. In humans, the large intestines have haustra and Taenia coli, which gives it texture and pouches to it, but the cat does not have that. The cat does have a cecum like we do in the humans, and so what we see is this little pouch right on top. Right after the ileum goes in, you can see this pouch structure right there, and that is the cecum. The rest of the large intestines in the cat is first the ascending colon, transverse colon, and descending colon. They don't have a sigmoid colon. Why? Because you'll note that the large intestines or the colon in the cat does not go all the way over to the left lateral gutter. It stays down the center of the body, so they don't need a sigmoid colon. That's why they don't have a sigmoid. The other thing that we note is at the tip of the cecum here, we don't see that little tiny lymphoid structure called the appendix. They don't have appendix. They don't have a sigmoid colon, they don't have haustra, and they don't have Taenia coli. Okay, so that's dissection of the abdominal pelvic cavity so far. What else do we have in here? Well, underneath the stomach, if we can take the stomach now, we're going to pull on the spleen, the stomach, and lift this stuff all up. And what we would like to see underneath here is see if we can identify the structure right underneath the stomach. And there it is right there. This particular organ right here, which is going into this area where the duodenum is making this C-like extension. Let me get some of this omentum out of the way. And this is pancreas. Hard to see because it's got all of this dried blood on there. So let's see if I can clean this up a little bit more and so we can see it. And again, I'm going to use my scissors. Where did my forceps go? Here they are. Okay, I'm going to pause this. I do want to show you the technique I'm using here. So you can see this peritoneum, this visceral peritoneum covering the pancreas here. I want to expose the pancreas, so I'm going to stick my scissor in there and spread. And this will prevent me from totally destroying my pancreas. So I just wanted you to see that technique. Try to be delicate with your dissection here. And that's how I'm helping to expose the pancreas without completely destroying it as I move down here. There we go. And so there it is. There's the pancreas. All of this tissue right there. That organ right there. That's all the pancreas. These will look very different from one cat to another. Now, how do I know this is pancreas? What is this right here? That's the stomach. It's underneath the stomach. Number two, it's going into this little C gap here that's made by the duodenum. So there's the stomach over here. Here's the duodenum over here. Here's the letter C. That's the head of the pancreas sitting inside that little pouch. And so there's the head, there's the body, and here's the tail of the pancreas way out here. You know it's the pancreas because it's underneath the stomach. by location, because you can't go by the way it looks. In one cat, it's going to look dark brown like this, and another cat, it'll look light brown. They will have all different appearances and all different presentations when you look at them. The next structure that you need to know about in the abdominal pelvic cavity is behind the peritoneum, and God, these things are huge. That's a kidney. Oh my God, what's this cat got going on here? No, I'm sorry. Oh, okay, coming back to my dissection here. I got thrown off a little bit because I've never opened up a cat like this before, but this is part of the uterus of a cat, and these are called uterine horns. And so we got 1, 2, 3 baby kittens being developed in here, and the main uterine body is down here, and then 2 kittens on this side. The ovaries are at the tips of these here. Ovary on this side is way over here underneath. What I was originally looking for over here, it's located behind the peritoneum, and that's the kidneys. Okay, so let me get back to my scissors here and expose underneath the peritoneum here. I need my forceps. Let's first move this stuff out of the way. This is all peritoneum that I'm cutting here. This is parietal peritoneum because it's lining the cavity wall. Remember that the kidneys are located behind the peritoneum. They're retroperitoneal, and that's why you see the kidneys underneath. All this blue stuff, by the way, is latex. The veins in these cats are filled with latex, blue-colored veins, so that the veins look blue. And that's the whole purpose of that. Here we go. Here and here. And there you can see I'm starting to expose it little by little as I remove the peritoneum there. And so this is on the left side, and so that's going to be the left kidney. And now you can see, boom, there it is right there. Nice big kidney. And it was located underneath the peritoneum. All this latex doesn't belong there. When they tried to fill this vein, it burst, it blew up. And that's why it leaked all over the place. Normally, it's not supposed to do that. So what you would see going to this kidney here is the renal vein. Renal means kidney. And there's the red one. That's the renal artery. Where's the right one? It's underneath this side. So if we go, move, and reflect everything over this way, get these little kittens out of our way. Let's use this guy here. See if I can hold this all up this way. And retract this way. And again, hold this all down here. That's the inferior vena cava right there. That's the lower vein. And there's the kidney right there. So it's retroperitoneal. I got to remove the peritoneum off the top of it. You'll also note that there's all this fat around it. Fat. There's the peritoneum. Beautiful example of peritoneum. Okay. And the kidneys are behind that, retroperitoneal. Okay, and you can try to do this on your cats. And there, pop it out now. And there's the right kidney. So you should be able to identify the kidneys. The kidneys will have ureters coming out of them. We'll be doing that when we do genitourinary system, which will be after the midterm. Where do they empty into? Way down here. So you'll see that's the urinary bladder. On either side of the urinary bladder are these huge fat pads. You can cut them off because there's no significance other than the fact that they allow for expansion of the urinary bladder when the urinary bladder fills up with urine. And they cushion it. They cushion that down there. So where was the uterus in this particular cat? Unlike in the human, where the uterus sits on top of the urinary bladder actually sits on top of the uterus. So there is the uterine body that has uterine horns coming off of it. And the kittens are given birth inside the uterine horns, by the way. So what comes out of the uterus? That's the vagina. So that's the vagina right there. Don't worry about uterine horns, vagina, and all of that reproductive, because we do that later. What you need to know is urinary bladder, right and left kidney. How do you do right and left? It's the cat's right and left. What else did we do here? We did the colon. So there's the colon. This cat is filled, by the way. You can see how hard and big it is. Some cats won't be that full. You've got the descending colon. There is no sigmoid colon. Transverse colon and ascending colon. There's the cecum. Here's the ilium as it's going into the ascending colon and the cecum. And so you got ilium, you've got the jejunum, and where's the duodenum? The beginning part of this, right, as it comes out of the stomach. Where's the stomach? There it is up here. You want to see stomach better? Let's put all of this down. There it is right there. There's the stomach, and it's full. And so coming out of the stomach, there's the duodenum. Okay, so now you can see how I'm getting this much better exposed as we keep progressing with our dissection. Let's take some of these adhesions away and cut them. Boop, and boop there. Oh, look at that. I freed that up nicely. So these are all, what's all of this stuff holding this? That's the mesentery. And so all of this stuff here that's connected to the duodenum, it's shaped like the letter C, that's mesoduodenum. Mesoduodenum right there. All of this stuff here that's connected to the jejunum and ilium, that's the mesentery proper. That's the mesentery proper. Different levels of the colon will have different names to it, above the scope of this class though. So all of this stuff here, here's the colon, and all of this stuff here connected to the colon, all of that, mesocolon. That's all you need to know, mesocolon. Mesocolon, mesentery proper, mesoduodenum. Keep working our way back, coming off the stomach, all of this apron-like structure here, that's the greater omentum. Greater omentum. There's the stomach, here's the spleen, and how do you know it's spleen? Left lateral gutter, left side, location, location, location. Look underneath the stomach, let's lift up the greater omentum. Lift up the stomach, and there's the pancreas. How do you know it's pancreas? It's underneath the stomach, and it's going to the duodenum over here. And then there's the liver. Don't worry about the lobes of the liver from my class. Other classes want you to know the lobes. Here's the two right lobes. Medial right lobe of the liver, lateral right lobe of the liver, the two lobes on the left side, medial lobe of the left liver, lateral lobe of the left liver, and there's the gall bladder between the two right lobes. Where's the caudate, by the way? It's underneath, so you got to pull this stuff all up, and there it is, right down there. There's the caudate. There's the caudate lobe, right there. That's why I don't ask lobes of the liver, by the way. And what's this structure right there? That big muscle, that's the diaphragm. That putting your cat away, you're going to want to tag these cats to make sure you know it's yours. I'm going to give you a tag that has my name on it because we're going to be using this cat from now until the end of the term. And so down here on the leg somewhere, just put this in through here. You've got these little ties that put these together. Let's see, make sure I do it right. Okay, that way. And put this way and put that in here. And this will have my name on it. And we'll make sure we get it into the right cabinet because we have locks on our cabinets now to make sure you get your cat each time you come back. And of course, these things just fit, so I'm having trouble getting that thing started because my gloves are wet. Okay, it's not going anywhere. Now that you've got that done, that whole thing with keeping things wet, yeah, give it a wash, get it nice and wet, because that's what will keep this thing nice and fresh each time you open it up. And close everything back up, okay? These flaps of skin that you had, you don't want to cut those off because then if these things dry out, that makes it hard to see anything that's inside. We'll be using this thing for arteries in the thoracic cavity and reproductive organs. So now that you got that nice and wet, like I got it here, I'm going to close this all up and I'm going to stick it into a new bag. We got new bags for this. These bags are a lot more flexible. It's easiest if you start with the head. Stick the head in there first. Once you got the head started, push it through. It's also much easier if you've got somebody to help you. I've gotten used to doing this on my own, but you just keep sticking it up and work it down into the bag. Now that you've got it down into the bag, get it all the way down at the end. It's best if you get as much air out of, just like you're preserving your food at home. What do they tell you to get? Tupperware tells you, get all that air out of that bag, right? Yeah, try to do that also with this. And so I squeeze as much of the air out as I possibly can. Squeeze it down at this end and fold the end over. Okay, so let me bring this up here so you can see what the heck I'm doing. See, I got the end folded over. Now that you've got it folded over, you also will have rubber bands on your table. And so use a rubber band to go around it this way. Okay, now the toe tag's inside there, and we could read it inside there, but you need a tag that also has your name on it. So you will also be given a tag that you could stick your name on, and what class you're in, AP2, Monday class or Wednesday class. That's my 2 AP2 classes. And then stick it in here inside the rubber band so you know how to get your cat for your next class. And we'll try to make sure that you get your same cat each time. This way, if you're careful with it, you deserve to have a nice, clean cat each time you come. Put it in there, and we'll put it in the cabinets when class is done. And you're all set. Good luck.